Tulane medical student. It's a pleasure to be here today. Today, I'll be reporting a case related to a patient with epilepsy with first manic episode at 32 years of age. So there are a number of studies that have examined the occurrence of affective disorders in the context of epilepsy, but these studies generally focus on depression and few have focused on mania. There are case reports of patients with epilepsy experiencing postictal manic symptoms. In this situation, there is generally a 4-sequence period of lucidity, mania, hypomania, and remission. In individuals with epilepsy, the prevalence of bipolar disorder is only 1.5%, whereas the prevalence of postictal mania is 11.8% by comparison. This case report reveals a patient with past medical history of epilepsy with no reported psychiatric history of depression or mania who presented with 2 recent episodes of mania with no recent seizures. So to give more specific information related to the patient, I'll start with this. A 32-year-old male with a history of epilepsy presented to the psychiatric emergency department with symptoms of decreased sleep, elevated mood, flight of ideas, pressured speech, bizarre behavior, and grandiosity. Collateral from the family revealed what was suggestive of a recent manic episode 6 weeks before his current admission. His current symptoms were more severe than those of his previous episode and had been occurring for more than 1 week and causing significant functional impairment. In terms of management outcome and follow-up, the patient tested negative on UDS. He ordered a brain MRI. The result was normal. The patient was currently taking lamotrigine, but had been gradually reducing his recommended dose for years with no reported seizures, as reported by the patient personally, as well as collateral obtained from the family. Initially, the patient had limited insight into his mania, but after his second day of admission, he agreed to try a mood stabilizer, specifically valproic acid. The patient responded well to the mood stabilizer with a remission of manic symptoms in approximately 1 week from admission. The patient was scheduled upon discharge to follow up with a primary care physician, a recently scheduled psychiatrist, and a neurologist. So the final diagnosis was epilepsy with bipolar disorder type 1. Having said all of that, I want to thank the SMA for organizing this amazing event. I want to open up the opportunity for the audience to ask questions or give any comments. Thank you.
How long does postictal mania generally last?
So I don't remember exactly from the reports I read, but it's a shorter time frame than mania because typically mania would be over 7 days. From what I recall, postictal mania would typically resolve in about 24 to 48 hours, but I don't want to misquote the studies, but it's definitely a shorter time frame than traditional mania.
Did he ever have any postictal mania or unclear, I guess?
To be balanced, I'd say it's either unclear or there's no history. So he lived with his family his entire life. And his family was constantly monitoring him because he was diagnosed with epilepsy in early elementary school. They had never witnessed him having a seizure during his childhood or during his adulthood, and he personally reported not having any seizures after he started taking treatment for epilepsy. So from that perspective, I don't think he had postictal mania previously.
Any other questions? Thank you.
Thank you.